Assalamualaikum. I am Nurul Amila binti Amir Hussein. As representative from Group 13 that consists of 5 members, will present our project on COVID-19 epidemiology, which is about modeling COVID-19 outbreaks in Malaysia using a system of differential equations. We choose research paper 3 as our research article, and the title of this group project is Unraveling the Possibilities of COVID-19 Dispersion by using SIR model. COVID-19 is a major health threat across the globe which causes severe acute respiratory syndrome, and it is highly contagious with significant mortality. In this study, we are going to study more on the transmission dynamics of COVID-19 using Malaysia as case study by using SIR model, and the impacts of limited medical resources on reinfection course of COVID-19.
Bismillahirrahmanirrahim. My name is Nur Umi Fatimah binti Muhammad Nasar. My matric number is 141028. Okay, let's continue about modeling part. Okay, the model that we choose for our project is SIRS model obtained from research paper 3. This is the model, and the parameter in the model with its description is as stated here. So you can read. Okay. Have you ever wondered how this SIRS model is obtained? Okay, this SIRS model is obtained, or this SIRS model is the extended version from the basic SIR model. This SIR model. This one is the extended with the some parameters addition. So can you see any parameters that is added in this model? So the first parameter is this one. Second is this, and the final one is this. So the difference between the SIR model and SIRS model is that the first parameter is phi I over P plus I is medical resources to tackle the COVID-19 pandemic. When the value is larger, it indicates that more efficient medical resources are available. Next one is epsilon R, the individuals who get reinfected from the recovered population. Okay, let's move into theoretical part. For the theoretical part, the first one, we are going to talk about the steady state. Okay, how to find the steady state? Okay, the steady state can be calculated by setting the time derivative of the model equal to 0. So this one, like this, and then you will obtain like this. This is the derivative equals to 0. Equation 1, equation 2, and equation 3 respectively. So to find the steady state, we will do some calculation. The first one, from the equation 2, we have this. So from here, you can see this bracket 1. This one cannot be equals to 0 because all these parameters in this bracket are being used to investigate this project. So when we equals to 0, that means we are not investigating anything, so it cannot be 0. Then we have I equals to 0. So put I into equation 3, and the same case happened. So R equals to 0. So we obtain already I and R equals to 0. This I and R substitute back into equation 1, and you will obtain an equilibrium. This is the equilibrium. So what equilibrium is this? Okay, thus we got this. We get two steady state. The first one is this one, just now we calculated, known as disease-free equilibrium. The second one is this one. This is known as the pandemic equilibrium, and this steady state demonstrates the persistence of the disease. Okay, just now we already talked about the pandemic equilibrium. For this steady state, we use Mathematica to calculate the steady state. So this is the steady state that we obtained. The first one, this one for pandemic, and the second one is this. Okay, now let's talk about the epidemiological importance of steady state. Okay, the first one is this one. This one is known as disease-free equilibrium or steady state. The steady state depicts the eradication of the disease and prevent the spread of infection. And the second one is SIR, this one. This is pandemic equilibrium. The steady state demonstrates the persistence of the disease and the COVID-19 infection that can spread in the community. Okay. So we already have the steady state. Okay, now have you wondered what do you need to use why do you need the steady state? So we need to know the steady state nature first. The nature of steady state can be found by employing local stability analysis. For this one, these two steady state, we need to find the nature by employing local stability analysis to know whether the steady state is stable or not.
Going to talk about eigenvalues. Eigenvalues are always important because it determines steady state is stable or not stable. We calculated eigenvalues by setting the time derivatives in the model equal to 0. Delta s or delta t equal to 0. Delta I over delta t equal to 0. Delta r over delta t equal to 0. Then we get this one. And then by using the Jacobian matrix, we get 3 eigenvalues. Number 1, number 2, and number 3. And because all the parameters are non-negative, so minus 3 is less than 0, and minus 3 and minus epsilon are both less than 0. Then the lambda 1 and the lambda 2 is less than 0. When the eigenvalues of a Jacobian matrix are less than 0 or equal to 0, the equilibrium is stable. They will consider lambda 3. When lambda 3 is less than or equal to 0, the right hand side is less than 0 or equal to 0. Then according to different parameters, we get the following answers, these 3. Then we talk about the pandemical equilibrium. For this part, we used the empirical estimates obtained in the journal article. Here is empirical estimates, and here is initial conditions. And then we use mathematical software and get follow results. There is a desert-free equilibrium, and here is pandemical equilibrium. And there is section on basic reproduction number R0, and the following is an introduction to R0. And below that, R0 is less than 1, means the situation is getting better, and R0 is equal to 1, which means the number of infection has top peaked. And if R0 is larger than 1, with the situation will continue to worsen. And we know that under SIR standard model, R0 is beta over gamma. And beta means the transmission rate, and gamma means recover rate. So in here, R0 is eta over psi. Then we can get the 0 is equal to 0 and phi is equal to 1, get the S1 R0A. And if we get 0 is larger than 0 and phi is equal to 1, we get this one R0B. And we just need phi 0 is larger than 0, we get this one R03. And since R0 is eta over psi, this form, so I prefer to eta on the top and psi on the bottom. And then consider the empirical estimates obtained in the general article. We have our 0 and phi. Phi 0 is not equal to 1 and 0 is larger than 0. Then we can use our R03 here. Get this one 0.727. This one is less than 1. So it's a good news. Because we know the R0 is less than 1 means our writing is starting to get better.
Hello, I am Nur Akida binti Mak Yasim, and here for the numerical time series, we have tutorial video about the actual number of cases in Malaysia in interval 20 January 2021 until until 1 November 2021 using MATLAB. And also we also shown the video tutorial about the number cases when using different value of epsilon using XPower. For Figure 1, the actual number of cases in Malaysia in interval 20 January 2021 till 1 November 2021. Based on the graph, there is huge difference between infected and recovered population. Theoretically, basic reproduction number R0 is greater than 1, means that the infection is spreading in community with the increase of daily cases. It is observed that when the infection force is rather high, the number of active cases spike again in June, and death rate becomes increased over the time. The outbreaks happened at the end of July to September 2021, when the death rate uncontrollably increased to three figures number. As can be seen from the graph, from March to May, the successive wave in the infection force decreased and potentially less dangerous. In general, the outbreaks may establish or not depending on whether initial condition belong to the basin of attraction of pandemic or of disease-free equilibrium. At the end of October 2021, government has declared that COVID-19 in Malaysia as endemic phase, and it is clear that the steady state become unstable. This indicates that COVID-19 infection keep on worsening along the years as number of infected individuals has not reached single digit till now. As latest as we know, the COVID-19 cases has increased to 10,089 active cases on 6 February 2022. This clearly indicates the statement stated above.
Hi, my name is Wanuri binti Zainuddin. So I will be explaining about the epsilon graph. So here is the epsilon graph, figure 2. As you can see here, there are four different values of epsilon. The first one is the orange one, the orange curve, which is the first line, where the epsilon value is 0.012. The second one, the yellow one, epsilon value is 0.003242, and the blue curve, epsilon value 0.009, and the red curve for the epsilon value equal to 0. So as you can see here from the figure 2, it is observed that increasing in epsilon yields a larger force of infection. This is shown by the orange curve, where the value of 0.012, whereby the number of cases remain in the range of 40 to 50,000 days. As epsilon approaching to 0, the number of cases flattening and eventually would be 0 after approximately a year. When limited medical P greater than 0, the calculated basic reproduction numbers are not from this model are 0.39090629, and another R0 is 0.7272718885. So theoretically, when R0 less than 1, meaning that COVID-19 is starting to get better as the spread of infection gradually slow down in the community. However, from the SIRS model, predicted spike in June and have an outbreak at the end of July to September 2021. From figure 1, before the spread of infection gradually slow down and the number of cases decrease.
Government of Malaysia is playing an important role in battling COVID-19. Among the effective efforts taken by the Government of Malaysia to handle COVID-19 are enforcing movement control order, speeding up vaccination rate, conducting community testing, and developing My Sejahtera application. One of the government's efforts in combating COVID-19 outbreaks is enforcing movement control order. Based on the graph, we can see the epidemic curve was flattened from February to May of 2021. This result was achieved because of the strict restrictions was executed from 13 to 26 January 2021. There are so many evidence that have shown the effectiveness of movement control order in reducing the transmission risk of COVID-19. Next, from the graph, we can identify that the pandemic curve was dramatically increasing from July and reached its peak in September 2021. In response to it, the government speed up the vaccination process. From October, we can see the curve was decreasing gradually. That signifies the reduction in the number of cases. This is because of the rise in the number of vaccinated people. Despite the efforts that has been done by the government, the effectiveness of vaccines will reduce over time and people can be reinfected. Thus, Malaysia government is strengthening its effort to implement effective vaccination strategies such as executing booster dose awareness campaigns, increasing the number of vaccination centers, increasing the supply of vaccines, starting vaccination for children, and deploying mobile vaccination clinics. The government also conducts community testing. The community testing allows us to detect possible cases and provide more data that can be used to predict and control the spread of disease. The data also allows the scientists to investigate the behavior of the virus and its mutation that are very helpful for future prevention. Last but not least, our government develops My Sejahtera application to aid in handling COVID-19 outbreaks in Malaysia. The application is very useful to identify positive cases through contact tracing and self-assessment feature. Next, we will discuss the issues of moral decision-making in adapting to COVID-19 pandemic, which are saving livelihood or lives, choosing patients to be treated first, school openings or closures, and visiting parents or obey the restriction rules. Our moral principles and decisions could be affected by COVID-19 pandemic as we are struggling to live. For example, people are in dilemma to save livelihood or lives. Because of the lockdown, the economy has been slowing down. The continuous lockdown could lead to people lose their livelihood. Some people are willing to break the quarantine rule and go to workplace to not lose livelihood. Businesses operate more than the allowable operating hours, or employers ask the infected employees to come to work. Even though it is hard situation for some people, they should not risk other people. After all, we agree that we should be alive first to be able to feed our family. Next, choosing patients to be treated first is one of the decisions that challenge our moral principle. In this pandemic, hospitals are overwhelmed with patients and medical resources become limited. There are not enough hospital beds and ventilators. This gives heavy burden to doctors that should make the decision by following the guidelines or prioritization strategies. This situation should be avoided by increasing the number of hospitals and improving the healthcare system. Schools are forced to close during pandemic is an issue of moral decision making. The pandemic raises dilemma to Ministry of Education because the school closure will hugely impact the education system and communities. The education is disrupted by the pandemic, causing the students to be left behind. In result, COVID-19 has caused UPSR to be abolished and PT3 to be cancelled. The teachers also face the challenges to keep students to attend the online class and engage during online learning. We agree that schools should be closed when there are infected cases in the schools. Lastly, going back to hometown is assumed to be the issue of moral decision making. Usually, when the movement restriction order was announced, people were going back to hometown because they were worried for their parents. Moreover, we can see that the cases increased when people went to hometown for festive celebration. This is worrisome because elderly people are more likely to develop serious illness when they are infected. Thus, we agree that we should refrain ourselves from going back to hometown to protect our loved ones. We should adapt to new normal that encourage us to keep in touch with family through video calls. We learn the importance of eigenvalues, which determines the stability of steady states. Through the nature of steady states, we are able to know that whether this COVID-19 will show a positive or negative impacts. Next, the reproduction number is very important since it determines the rate of contagious of this COVID-19. The graph also really plays an important role as we can approximate our situation in battling this COVID-19. Modeling helps us to have a better understanding about the relationship of mathematical models to capture the disease spread before and after MCO implementation in Malaysia.